Good evening and thanks for joining us for this update from your coronavirus headquarters. I'm Mike Thompson. Taking a look at the latest coronavirus numbers from the pandemic, nearly 19,900 people have tested positive for COVID-19 in Wisconsin now. 291,000 people have tested negative and 626 people have died. Nearly 13,000 people have recovered in the state. 2 new cases are being reported in Eau Claire County and Trempealeau County, and 1 new case in La Crosse County. In Minnesota, more than 26,200 people have tested positive and a little more than 249,000 have tested negative. 1,115 people have died. And in Iowa, a little more than 20,800 people have tested positive, more than 154,000 people have tested negative, 580 people have died in that state, and a little more than 12,300 people have recovered. All 24 positive cases reported in Winneshiek County have now recovered. The Wisconsin Department of Corrections is preparing to resume more normal operations. Part of its plan is to test all prisoners and staff in the state's 36 adult prisons for COVID-19. On Monday, the department started accepting new prisoners and transfers again after an order that Governor Tony Evers issued on March 23rd expired. According to the Wisconsin State Journal, new prisoners and transfers have to quarantine for 14 days. Visits from friends and family remain suspended. The department is about a third of the way through its plan that started in May to test nearly 22,000 adult inmates. Coronavirus has been on our minds for months now, but there's still some confusion about it and testing for COVID-19. There are 2 types of tests. The first one is swab testing, which is used to find out if you currently have the virus. If you're showing signs and symptoms of the virus, this is the test you'll receive. The second one is a blood test, which shows if you've been exposed to the virus and have developed some degree of immunity against it. It also helps health experts determine how many people in a population have been infected with COVID-19. You'll often hear this referred to as antibody testing. Health officials say antibody testing doesn't tell the whole story, though, and can give some false sense of security.
So let's say you test positive for it on the antibody, arguing that you've had an exposure. We don't know if that confers protection or immunity. So I think that's very important to distinguish.
There's another important reason for the blood test. It can identify people who have recovered from COVID-19 and may want to donate plasma, which is used to treat other patients with severe COVID-19. A lot of us have had to put off doctor's appointments and wondering if it's safe to reschedule them. Many health facilities are starting to ease up restrictions and accept patients again, but they have some recommendations before making an appointment. Find out what kind of steps health providers are taking to keep people safe so you know what to expect when you show up. Many places will require you to wear a mask and practice social distancing, and be prepared for limited appointment times as well. Most importantly, make an appointment sooner than later.
We're hoping to kind of get the message out there that it's safe to return, that we've taken the precautions in place to keep you safe, and we need to start working on treating other medical conditions which can also be dangerous to your health.
If you still have concerns about visiting your doctor, consider telemedicine appointments and plan ahead for prescription refills. You can talk to your doctor about getting a larger supply of your medications and even have them mailed to you. Well, that's our update for now. Thanks for joining us. We hope to see you back here on News 8 Now at 10.